Welcome to the Longevity Formula with Dr. Brandon Crawford. Let's explore the new era of wellness.
We all want to live longer, healthier lives, right? And we've been told the key is diet, exercise, and avoiding bad habits, and all that's true. But what if that's only part of the story? What if our bodies already have something built in, something even more powerful that we're just not tapping into? We tend to think of aging as something that happens to us, like an unstoppable force we just have to accept. But what if that's not entirely true? What if our bodies already have everything they need to repair, regenerate, and potentially even reverse aspects of aging? What if the key to unlocking this potential lies in understanding and supporting our stem cells, our body's built-in repair system? If you're new to stem cell science, here's what you need to know. Every day, your body releases stem cells from areas like your bone marrow into your bloodstream. Think of stem cells like your body's emergency response team. When there's damage, whether from an injury, illness, or just daily wear and tear, these cells rush in to repair and regenerate. But as we get older, fewer stem cells are available to do the job. And that might be the real reason we age. Today's guest, Christian Drapeau, has spent over 30 years diving deep into the science of how our bodies actually heal. And what has he uncovered? It's completely shifting the way we think about aging. This isn't just theory. This is real, practical science that can change how we approach longevity. And the best part is something anyone can take advantage of. Welcome to the Longevity Formula, the podcast where we explore a new era of wellness through the pillars of faith, light, movement, mindset, nutrition, and science. I'm your host, Dr. Brandon Crawford. Christian, thank you so much for joining us today. I'm very excited to have this conversation with you. Can you do us a favor? Can you give us a little bit about your background so we can better understand, the audience can better understand who they're going to learn from today?
Okay, my original training was in neuroscience. I'm a neurophysicist trained at McGill University. So initially I was working on epilepsy and memory at the Montreal Neurological Institute. And then I was always, I've been, as far as I remember, always interested in plants. So while I was studying neurophysiology, I was playing with plants. So at some point early in my career, I had this opportunity to go and work for a company selling herbal extracts, herbal products. And I saw this like as a great place for me to blend sort of my two interests. So I shifted from research. I continued in research, but I shifted from brain research to plants. So that's sort of the background that led me to the discoveries that we made with stem cells.
That's amazing. We're going to really dive deep into this amazing product line that you've developed. It's called Stemmergen. What I'll tell people is, number one, I personally take it, but I take a lot of things. What's really exciting is that my wife actually takes this, and anyone that's listened to me before knows that something has to really work for my wife to take it. She feels more energy. It makes her gut work better. It just makes her feel better overall. In fact, if she stops taking it, she'll, eventually, we'll be laying in bed and she'll be like, "Oh, I need to start taking my Stemmergen again." I'm like, "I've never heard you say this about a product." So that's great. And then my integrative psychologist, Dr. Jerry Levine, she is just completely in love with the product line. We use it clinically. We have patients taking it before and after our regenerative medicine procedures. We recommend it for anyone to help enhance neuroplasticity because of the influence that it does have on stem cells. So, and like I said, we're going to dive deeper into this, but can you give us the background about how this product line really came to be?
Well, in 1995, so I'm going back to what I was just saying before. In 1995, I was hired by a company that was selling a product that you may have heard about, blue-green algae from Klamath Lake from Southern Oregon. Mm-hmm. So it was right after the passage of the Dietary Supplement Health and Education Act, and the companies selling product needed to have science to back up the claims that they were making. So that's why I was hired. So we very quickly identified the mechanisms of action for the benefits on inflammation, on the immune system, and on the mind. But as I'm doing all this work, I came across people reversing multiple sclerosis, diabetes, heart disease, emphysema, Parkinson, Alzheimer's, so many conditions, not only so many conditions, but like the extent of these benefits was great. But to me, the big mystery from a scientific standpoint was, what is this product doing to help someone's liver, someone else's pancreas, someone else's lungs, someone else's brain? So what is the one mechanism touching so many different aspects of human health? And after a number of years, we discovered in the early days of stem cell research in 2001 that this product was acting as a stem cell mobilizer, was putting more stem cells in circulation. When we completed the description of the mechanism of action, proof of concept, bioactives, patents, when all of this was done, in my mind, there could not be just one plant having an effect on stem cells. So I started to look at other plants historically associated with a broad variety of benefits, and we started to study them. So StemRogen release is the blend of the top 5 plants that we have documented act as stem cell mobilizers. Now, over the years, we saw great results on StemRogen release alone, just releasing stem cells. But at the same time, there were a number of individuals where we could tell that they were not getting all the benefits that we would have expected. So the question is, what stands in the way of stem cells once they have been released to really play their regenerative role in the body, or even stem cells that are injected once they're in the bloodstream? What can be an obstacle for them to do their full regenerative potential? Because when that is open, the regenerative potential is is amazing. Mm-hmm. So the two things is systemic inflammation. It is noise in your bloodstream that makes stem cells less effective at identifying where they need to go in the body, where there's something that needs repair. And when they find where to go and they go into the fine microvasculature, the fine capillaries, which is where they need to go to be able to migrate into tissues. Well, if you don't have a good microcirculation, then stem cells don't have access to the area where they need to go. Because a stem cell can be 20 micron, your capillaries is 12 microns. And so we developed the product to open this microvasculature. So StemRogen releases stem cells, signal improves the signaling so stem cells can better see where to go, and mobilize facilitates their movement into capillaries by opening the microvasculature. So that's kind of how these products came together.
That's amazing. And you do such a better job explaining those mechanisms behind those products than I do. I always try to kind of regurgitate that for everyone because it is, you just described 3 different products and you do have a fourth, which is for sports, right? More of
Correct.
Can you maybe just elaborate a little bit on how that product differentiates and what it replaces?
Sport is essentially the sports version of release. So it does the same thing as release in terms of putting more stem cells in circulation, but we wanted to achieve 2 things. We wanted to make this product more specific to recovery from physical exertion. So in order to support the repair of ligaments, muscle, tendons, joints, and so on. And at the same time, allow this product to be certified NSF. So this is an NSF certified product. So athletes who get tested can use it. So for us, the aim is to be able to really put that in the hands of professional athletes. And so it's both certified for drug testing, but at the same time, boosted to help repair anything that gets damaged when you do, intense physical activity.
Nice. Yeah. And definitely, we work with pretty high level athletes. Some I've signed agreements saying I can't discuss who and whatnot. And I will say, this is definitely something that we recommend. And you do see better recovery, better performance. The results are there. The results are there both clinically as we're working through some type of pathology or disease state or rehabbing a brain, whatever we're doing. I can attest clinically results are there. From an athletic standpoint, we see it as well, and we get the reports back. And I know you do too, but I'm just saying from our perspective. But what I really love is that you guys have real science and you guys have real substantive evidence that supports what your product does, why it works, how it works, et cetera. I truly appreciate that. Honestly, the 2 products that I've just been over the moon about, it's Stemmergen, the product line, and Fatty 15. I have not seen anything better, and I've been doing this for about 15 years. I'm not super old, but I'm getting there. but I've been pretty entrenched in the clinical world for about 15 years. And you guys are just doing a phenomenal job. So the product line's amazing. Can you help unpack how to navigate the use, right? Because you can start using those three products depending on what your goal is. Maybe you use those three products and then you shift into just using release for, more of a, long-term solution. Like, can you kind of help us understand some ways to use the products?
Sure. So the Stemmergen release, you take 2 capsules and on average, you will release about 10 million of your own stem cells within 2-3 hours. I say 10 million, it's the measurement, it's the highest point, but at one time point. We take a blood sample and that's 10 million. We need to understand that stem cells are being released and then they migrate into tissues. So the picture that we're taking is a very active picture. And I'm saying this just to say 10 million is definitely an understatement, but sticking with the data, an average of 10 million additional stem cells in circulation. If you do this more than once a day, so in our studies, we do this 3 times a day. So you've released roughly like 30 million of your own stem cells during a day. You don't have to do this, but we do this in our clinical trials where we have a study, for example, on congestive heart failure, Parkinson. We're starting one on COPD, liver failure. So we're tackling conditions that are affecting a lot of people where medicine cannot do a whole lot. So we boost the repair system of the body as much as we can. So people don't have to do this, but that's what StemRogen release will do. You don't have to take it on an empty stomach. It really doesn't matter. The other 2 products, both Signal and Mobilize, contain digestive enzymes, and we want the effect of these enzymes to be in the bloodstream. So to get that, these products need to be taken on an empty stomach. The effect will last much longer during the day. So you can take, the best way of taking these products in the morning, Mobilize is a sachet. You just mix it with water. You take 4 tablets of Signal. It contains various plant extract that will block the synthesis of various inflammatory compounds through various pathways, both of them on an empty stomach. And then you take 2 capsules of release. So the 3 of them, when you reach like the peak release of stem cells, you've also reached peak opening of your capillaries, reduction of systemic inflammation, but the effect on circulation and inflammation will last throughout the day. So you can then other times in the day, if you want, another time or 2 other times to take another 2 capsules of StemRogen release. That is sort of what we call our advanced protocol. You really want to give a boost in your repair. You want to see what your body will do with that repair. You do the advanced protocol for, let's say, for a month or 2. Then you can kind of go back down into baseline just with a simple stimulation every day of releasing stem cells. Whether you want to use Signal or Mobilize for the long term, I would say depends on your overall physiology. Like, if you tend to have a poor circulation. If you have, and I'm not saying that these are like all or none, but if you say yes to any of those, like you tend to have cold feet, you tend to have cold hands, you tend to easily get numb in your legs. You try to stand on one leg and you cannot stand on one leg more than 1 minute. Oftentimes, like these are signs that you get some level of neuropathy that is developing. It's not clinical. It's no big deal, but it's all tied to poor circulation. So you know that you're releasing stem cells. They may not reach everywhere in the body. So I would say Mobilize gets to be like a really good product. If you get up in the morning and you've got little aches and pain and it takes a little while before it stretches and you start to be comfortable in your day, well, you have some level of background inflammation in your body, then Signal would be a good product to take to kind of bring that down and opens the path for your stem cells to go where they need to go. Let me just finish by saying that a product like Mobilize, to me, when I was doing my class I did sort of all the same class that med student would do, but I was interested in research. And when we did the cardiovascular class, I was fascinated by the whole hemodynamics, like the way with which blood circulates in blood vessels, how when you get a fork in your capillaries or your blood vessels, how this creates turbulence, the whole dynamics of blood flow. And I was amazed by one thing that I've almost like never heard ever since into popular medicine, even in main medicine, is that you take a blood sample, we tell you everything about your blood profile, and we never look as to whether that blood that has whatever profile it has, is it reaching your fine capillaries? Because if it is not reaching your fine capillaries, it really does not matter what you have in your blood. So the health of your microcirculation is absolutely paramount for the health of your overall body. And that's why we made Mobilize. So nattokinase to increase blood fluidity, nitric oxide producer to dilate capillaries, bioflavonoids and plant extract to support the flexibility of capillaries, and then the polysaccharides to rebuild the glycocalyx, which is at the surface of capillaries to facilitate cellular trafficking in these capillaries. So stem cells or not, Mobilize is also going to really boost your overall health by supporting the delivery of everything into your, that you have in your bloodstream. Does that give like a good overview of how to use the products?
Absolutely. And those are all discussions that, we definitely help patients navigate, how to take and why maybe they need to do Mobilize long term or, something like that, which I will say something that I like to do for my post TBI patients. Like if I can get a hold of someone like pretty soon after they had a mild to moderate traumatic brain injury, one thing we always have to make sure is happening is their blood flow is appropriate in their brain. I love using this product line, especially in that scenario. Obviously, the person's already been screened for, all the bad stuff and the scary stuff. So that I'm not saying this replaces that, but I have seen this product line help to normalize that blood flow in the post TBI phase. And then, of course, going through rehab, we need blood flow, we need stem cells, we need all these things to happen for, for pathways to form, for neuroplasticity to form. Super, super important. I'm sitting here listening to you about, you take, a couple of release and at least get this 10 million, stem cells released into the blood. I mean, what happens if I just take the whole bottle? I mean, what is there a max dose here? What happens?
There's no max dose as we know it, like scientifically. Is there a point of diminishing return where if you take more than a certain amount, then it's not really helping you? I really don't have the answer to that question. Okay. In order to study these small differences, you would need like a significant population. So it would be, let's say, like a $1.5 million study to tell you that taking 4 is better than taking 2. And over the years, I can tell you more is traditionally better. For about 6 years, I took 18 capsules a day. So 6 capsules, 3 times a day, because I had access to the product, number one. And number two, I had this question, like, what is something going to show up if really we take a lot of products? And I never experienced anything unusual. I cannot tell you if there was nothing like negative that ever showed up. And I did not experience anything out of the ordinary, but I'm healthy. Like I did not have any problem. But I'm looking back now, and one thing I could say is that I have like over 3 million air miles. I've lectured in 50 plus countries on stem cells over the years. I've been traveling so much, and I don't have any of the consequence, that oftentimes when people have traveled a lot, they end up with a series of issues. And I can surf jet lags like I'm doing fine. So is it because I had this boost over the years? I don't know. But in our studies, we don't go to 18 capsules a day. We do 6. So 2 capsules 3 times a day. StemRogen is stronger than other products that I had in the past. So 2 capsules 3 times a day I think is good enough. We have one ongoing study right now with stable congestive heart failure, chronic stable congestive heart failure. And so far in that study, out of 10 patients, 10 out of 10 have normal heart function after 6 months. So 2-3 times a day seems to really do the job. Could 2 once a day do the job? There's no doubt in my mind that in some patient it will. But we're doing a study. We want to maximize the outcome. We want to make sure that we can really document this and publish the data. So we do 2-3 times a day. I would not go more than that.
That's actually quite impressive results. So is that ongoing or is that published?
Mm-hmm. It's not published. We are working right now. We're preparing the paper to publish the first set of data. It's preliminary data. So it's an ongoing study. We want to bring it to probably like 40 patients. Now we have 10 done and we have 3 groups. One group is StemRogen, one group is adipose stem cell injection, and another group is a combination of both. Because we have seen over the years that when you combine both, you really get the best results. So we want to be able to document both the benefit of combining both, and at the same time, how does StemRogen compare with a stem cell injection? So that is going to be the full study when it's completed.
That's amazing. So just so the audience understands, right? Because in the research world, a lot of things can happen. You can just research your product and not really compare it to anything and show that, hey, we got these results. And that needs to happen. That's good. But you just described as, hey, we're actually trying to figure out how to best help people. There's a big difference in, that. And it really just shows the mindset of your company and what you guys are really trying to achieve. Thank you for that, because that's what research is truly for. And, we've noticed the same thing is we do the Song laser activated V cell procedure. We do a few other regenerative med procedures. And I can absolutely say that when the patient does the Stemmergen products before and after, we absolutely get better results compared to if they don't do anything. So I can definitely say that it enhances the overall procedure for sure. Absolutely. I am curious, do you guys, so when you talk about the increase in stem cells in the blood, are we talking mesenchymal cells, or what type of stem cell are we seeing?
Well, over the years, we've added more and more markers, to kind of further describe and identify which stem cells is being enhanced with the product. And essentially it's three types of stem cells: mesenchymal stem cells, V cells, and then endothelial progenitor cells. These are the three types of stem cells that are the most affected with the product. So we never published the data, but at some point a patent was filed about it where we're targeting V cells. So what we were able to document is that we increase V cells roughly about like 30%. But we also activate about a third of them as well, compared to from before and after taking the product, within an hour or two of taking the product. So in a procedure like what you're doing, it's going to like magnify the procedure, because you will have more V cells to work with. And you will also have already primed some of these V cells to receive the stimulation that you're giving it. V cells treatment is one of the places where StemRogen gives a really strong synergy.
That is rather exciting. So can you unpack for the audience, like, why is that really exciting for me and for everyone else, that you can increase V cells like you can? I mean, these V cells, in my opinion, are the most exciting because of what they can do and their size and all the things. And there's still a lot that we need to know about them. But can you walk us through like some of the different stem cells and whatnot? Do you mind giving us a brief background on that?
Sure. I mean, we can easily go very complex there.
Yeah, sorry, I kind of pitched one up to you that could go in multiple directions.
No, it's good. It's good. But I just want first to plant in people's mind that scientists, and I'm not saying this like it's not a derogatory statement at all, because we have to do that to some extent, is that we label everything. You look at something, if it fits certain characteristics, you call that a mesenchymal stem cells. If it does other things, you call it a different name. And we classify like this stem cells according to different characteristics. And we kind of assume that once we put a label on it, and once it's been determined to be a type of stem cells, that it's like a dog. Now it's a pit bull. It's never going to be a Labrador. Stem cells are not like that. They're much more labile and flexible. I believe that they move much, much more freely into these different pools. There's studies, for example, showing that if you take a liver stem cells, so an oval cells, which is a stem cells specific to the liver, so it's a tissue committed stem cell, but you put it in the pancreas and it's going to become beta cells producing insulin. So the traditional science tells us when a stem cell gets into a lineage, then it cannot reverse back. And it's not true. There's a lot of data showing that there's way more flexibility in these stem cells. So as we keep that in mind, I'm going to call mesenchymal stem cells this sort of very broad class of stem cells that has more of this labile or flexible nature. So these stem cells are in your fat tissue. You don't release them from your fat tissue, but you can extract them, spin them, and use them for treatment. before I continue, another little tidbit of information, which I think is fascinating from a scientific standpoint. Mesenchymal stem cells refer to the mesenchyme. So they were originally the stem cells that are derived from the mesenchyme. They're in your bone marrow. So traditionally, that's where they're from. So you would take a sample of stem cells from the bone marrow. And what was seen is that if you just use a test tube and you just swirl the test tube, when you rinse that test tube, they are stuck to the glass. And that became a method to isolate these stem cells. You just use the proper medium, certain plastic will do it, glass, and they will stick to the side of the test tube. And then you just have to resuspend them and you've isolated your stem cells. And now that they later, scientists realized that when you take fat stem cells, they also stick to glasses. So they were called mesenchymal stem cells as well. So the way to determine what has been called the mesenchymal stem cells, the way to do this became like really broad in a way. So they are very precise way to call them, but in the scientific literature, it's not always very clear what method was used to call them mesenchymal stem cells. And that's why I'm saying it's a broad class. These stem cells have the ability of becoming just about anything in the body, but not anything. Like they cannot become egg, they cannot become sperm, and a few other of your hormonal tissue, or foundational tissues like Leydig cells, for example, and some others. But overall, they are your repair system. They can become just about everything. V cells, so endothelial progenitor cells is a stem cell that have started to go into a direction. They will become your endothelial cells making blood vessels. So they're very numerous in your bloodstream compared to other stem cells. Like stem cells are the population is very small in the blood, but among all those stem cells, endothelial progenitor cells is a good population because you're making blood vessels all the time. So they're really needed in any kind of tissue repair, anywhere in your body where you got a little bit of ischemia in your muscles, then it's going to prime these endothelial progenitor cells to increase delivery of oxygen to those tissues. So that's another type of stem cells. And then the last one is your V cells, the one that you're talking about. What is fascinating about V cells is that everybody has heard of PF, like platelet-rich fraction, platelet-rich plasma, that has been used by athletes and horses for decades. So you take the blood, you spin it, and you just inject that in joint, and it's extremely regenerative. But the traditional knowledge or language around this treatment is that it's not stem cells. It's growth factors that you have, in that platelet-rich fraction. Right. But what we know today is that in that fraction, you also collect a population of stem cells that are very small. So they've been called by various names. They've been called blastomere-like stem cells, multipotent adult stem cells, I think, and then V cells. The V cell name, very small embryonic-like stem cells, is the one that's stuck in the scientific literature. So that's the one that is the most used. So it's these very small stem cells that when you extract your platelets, they move with your platelets, but they are stem cells. Platelets have no DNA. So if you take all these small cells and then you stain them for DNA and you use marker of stem cells, you see that there's a small population of them that have DNA and they have markers for stem cells. They are these V cells. V cells have been broadly documented to play an enormous role in various kinds of injuries, muscle injuries. They've been known to be pooled in muscles, but also in the bone marrow. And the beauty of these stem cells is that they can become eggs, they can become sperm, they can become literally like everything in the body. So they are really, there's another type of stem cells that have been called muse. So multipotent, like stress-resistant stem cells, right. I think.
MUSC, yes, the Muse cells. I don't exactly remember the acronym, but yes, Muse cells for sure.
Yeah, but they call them like resisting to stress. And so they're very sturdy. I think they're isolated from connective tissue, but they have the same potential as V cells, but they're not as accessible. So today they're developing ways to be able to extract them and be able to use them. There's a great future for those. But today, V cells are probably the most potent stem cells that we have in the human bodies. So they are living most of the time, not most of the time. We find them in the bloodstream. The majority of them will be in a quiescent state, and that's when they're very small. When they are activated, they expand a little bit, they grow, they go from 1 micron to roughly about 3 microns. You can measure a lot of RNA expression, gene activation when that process is taking place. Various things can activate them. StemRogen release, we have seen, can activate them, but specific wavelengths can also activate them, and that's the work that you do. So I try to, like, in that explanation, sort of embed, what you're doing. So these are roughly like the different types of stem cells they're being used. Umbilical cord stem cells are broadly into the class of mesenchymal stem cells.
That's beautiful. That's such a great explanation. And you did just a phenomenal job breaking down all the different classes and all the different things and how to navigate that conversation. The size of those V cells, 1 to 3 microns, just as a comparison, typical mesenchymal cells are 25 to 30 microns, just to kind of give an example.
There's a broad range for them, but yeah, they can go up to 20, up to 30 microns as well. I would say average size, 15 to 30.
Right. And of course, I love the idea of the size of those V cells because they can more easily get into these tiny little capillary beds and in theory cross into the, through the blood-brain barrier, et cetera. So definitely, very, very exciting there. Just to kind of shift, I had a thought that popped into my head. I was doing a meeting yesterday, actually with the Softwave team. We were talking about how the Softwave technology influences brain function. We were talking about our clinical results, et cetera. And the conversation kind of shifted into a discussion on fertility. And so this was a group of physicians and researchers. And it was interesting that, sperm concentration over the past 50 years has declined roughly 50%, which is mind-boggling and scary. Have you seen any type, because this is a big problem. Have you guys seen or done any research or have any clinical anecdotes or anything where by using this product line, we see any kind of change in sperm morphology, concentration, motility, hormonal health, or anything in that realm?
Yes, but it is, let's be clear, it is anecdotal. I don't have the actual data. And it's a number of years ago. So someone was using, in a clinic, it was in Mexico. So in a clinic, 2 patients that were in a fertility clinic started to use our product. And then apparently the clinic noticed that within about 4 to 6 weeks, 8 weeks, their sperm count increased significantly, something like 5 million to 20 million within that time frame. So that was their response. Their response wow, what are you doing? So they shared that they were using this product. So the clinic reached out to us and so we structured a clinical trial using 14 couples that were in their clinic to whom we gave the product and both the man and the woman. And they measured various parameters over time. And so we shipped the product and about probably 4 to 6 months later, I asked the doctor that I was working with, which was the liaison with this clinic. And I said, so where are we with this project? He said, oh, don't tell me. They stopped the project. So I was concerned. I thought is something negative happened? He says, no, 7 of the couple. So basically it was destroying their model. But that's all the information that I have. I was never able to get any of the data. They never shared anything with me. So all I know is that story. And aside from that story, this vague report overall in the community of people using the products that if you're trying to conceive, then it would be good for you to get on the product because people are talking about how it has helped them conceive. I've never done a project on this simply because no other reason than we're limited. We have a small research team. We have a small budget to do these clinical trials, and to do a trial on this, fertility is a sensitive topic. I prefer to be more targeted, like heart disease. We're doing one on Parkinson. We're doing one on COPD, colitis. So these are metrics that, you take these 4 studies on lung, heart, brain, and digestive tract. And I think we're touching 80% of health problems in America. Right. So we're targeting those. That's the only reason why we did not do more of an in-depth study. We have a group right now in Turkey that have expressed a desire to do a fertility trial. So we might have one done in the coming year.
Nice. Yeah. I mean, and I don't even remember how we got on the topic of fertility yesterday, but it is just scary because, right now with the 50% decline over the 50 years, in sperm concentration. Right now, the average male still has enough, sperm to conceive. But if this trend continues, over the next 50 years and we decline another, that would be, proportionally another, 25% basically, then levels will not be adequate to conceive. So this is a big problem. And your product line just makes sense to me because, you're reducing the stress response ultimately in the body, right? With this combination of products, you're mitigating and modulating inflammation, you're improving microcirculation, you're improving nutrient delivery. Mm-hmm. And then for the regenerative effect, you're increasing stem cell count. This is huge. I mean, not just for fertility, but for all things. Can you walk me through some of the things that you guys are seeing with Parkinson's? Because I've seen a lot of Parkinson's patients over the years with varying results because it's so multifactorial. The etiology can be different, for all of these people. And like I said, we've had varying results. So can you walk us through some of the results you guys are seeing?
Sure. I mean, we've got a number of stories over the years, but as you know, stories, they don't have a scientific value out there to make claims. They have a value to me in the sense that they're telling me the kind of conditions where we do see benefits. But we have a star case a number of years ago who went from really not being able to dress himself, shave, eat, walk, drive his car, obviously. And within 6 weeks, had basically resumed a normal life. So we published that case a number of years ago, but it's a few of those cases that really prompted to do a more in-depth study. So we have this study that we're doing in a clinic in Madrid, which is where we have right now, most of our clinical trials are being done from that clinic. And we did the heart study there. And the Parkinson study, we started probably about a year ago now. And it's going slow for it's a sad reason. Most patients interested to get into the study go and see their treating neurologist and they say, hey, I'm interested to get in that study. Should I get into it? And the answer that they get from their neurologist is that nothing can repair the brain. It's a waste of time. This is a scam. So the patients are really sort of disincentivized to be part of the project. So it made it very difficult to recruit people in that study. So I should travel to Madrid to speak to their Parkinson Society to kind of make them more aware of the possibilities here. So I got the data on the 10 first patients just yesterday. So I have not yet had a chance to dive into the data of these 10 patients, but about 6 months ago, I got the first 4 patients. On those 4 patients, at the time, the data that we had was, sorry.
I feel you. I just got over the flu myself and I'm still not fully, I'm still having some challenges. I'm still coughing. It was bad, man. What I got hit with, it was terrible.
Mine was very light, but it was there. And right now, like you said, now I just have a little bit of the mucus that are flowing in there. On 4 patients, what we saw is a 50% reduction of motor symptoms. So the USPDR, I think, questionnaire and test, you ask them to stand on one leg. How long can they test? We're also doing voice analysis. I don't know how much you know of voice analysis. It is an amazing, fascinating diagnostic tool for just about anything. You record someone's voice and you can diagnose heart disease, hypertension, all kinds of problems. And Parkinson is one that has been documented quite a bit. So 50% improvement in motor skills, 36% reduction in depression, which is one of a huge component of Parkinson, and 56% improvement in overall quality of life measured with the SF-36 questionnaire. So that's where we were with the first 4 patients. So I'm going to dive here into 10 patients, but we want to grow that study to roughly about 30 patients.
That's amazing. And that was after how long of using the product?
6 months. So this is 6 months, 2 capsules, 3 times a day. And that study, we did not start it with the full protocol because we did not have the full protocol when we started the study. So we might very well include now the full protocol in these patients just to see what difference we see, because that's why we brought the mobilize and the signal, because in that study, we see very clearly, we have some patients, we do see some benefits, but after 6 months, the benefits are minimal. And then we have other patients within 6 weeks they've almost like reached maximal benefits. So they continue to take the product, but we can tell here they got like the bulk of the benefit up front. And these benefits are significant, like this case that we already published. Why? Why do we see that kind of difference in different people? And that it's based upon this kind of observation that we brought signal for systemic inflammation and mobilize for capillary circulation. It would be interested to take those patients in which we did not see a lot of benefits and now put them on the protocol and see, do we see benefits in these patients? But that's where we are today with that data.
And that just makes sense, because the midbrain, the basal ganglia, they're not very well perfused, right? You have the lenticular striate watershed going through there. It's just not a very well perfused area. Lacunar infarcts are one of the, big drivers of what presents like Parkinson's, right? So you can have an occlusion, hypoxia, reduction of blood flow and hypoxia that then results in degeneration of that midbrain region, producing Parkinsonian-like symptoms. These patients actually, in my clinical history, are the ones that we can actually do a lot with, because there's a lot of strategies that we can take to actually improve blood flow through that area. So it would just make sense to me that by including Mobilize would have a huge impact on those patients. So that's exciting. That's awesome.
Yeah.
Man. So
and there's something I came across a study recently. It was to me, it's fascinating. It's early, so there anything we say about it is sort of an extrapolation. Like the data is not there for these extrapolation. But what they did is that they took microplastic, the same type of microplastic that you find in a ready to serve food that you just put into your microwave. So they took these microplastic, they dyed them they put a fluorescent tag on them, and then they basically fed them to mice. And they were able to see some of these particles getting stuck in capillaries in the brain, and they would stick there for a few hours, and some of them stayed blocked for up to 4 weeks, which was the length of their study. And what they could see using cameras, in vivo cameras of the brain, and they could see that the moment that you get a microplastic particle that is stuck, oftentimes they get engulfed by macrophages, but then these macrophages gets inflamed, and then they get stuck into these microvasculature, and then they back up the circulation, and now you get very poor flow of serum into that circulation. So that means you get low-grade hypoxia. And the question is, to what extent is that also happening in humans? And to me, there's no question that to an extent, it's also happening in humans. Hence the point of the moment you can increase the diameter of these vessels, you can allow the flow circulation of plasma, which is cleansing, everything that is happening, delivery of cells, cleansing. It's huge what it brings to the overall process of tissue repair.
Right. Yeah. Microplastics are a real problem. There's now studies on this. There's good studies that have been done on this. It's still controversial. I don't really understand why. It's clear that it's out there and that it's causing harm. But whatever, there's always going to be debate on, what's driving chronic illness. But man, the data is so clear on this. So let's give some actionable steps. So obviously, starting the Stemmergen product line, if you haven't, is, in my opinion, a must if you want to maintain health. If you want to be, you want to gain an edge, right? Maybe you're a biohacker or an executive or an athlete or something like this, like gaining an edge, keeping an edge, super important. You have some kind of chronic debilitating illness, whether it's autoimmune, whether it's degenerative, whether it's traumatic, whatever it is. Like all of these demographics, in my clinical opinion, I'll take the liability from you. Like this is me speaking as a physician. All of these demographics, in my opinion, can really benefit from starting on Stemmergen. Of course, consult with your physician and make sure that, this is right for you, et cetera. But what are some other actionable steps that someone can take just on a daily basis, whether it's lifestyle, something that they can do to help to increase their stem cell health in volume or whatever it may be?
So right now, in terms of lifestyle, and before I go there, I think, Brandon, there's one thing that is super important. I always come back to that basics. We, the medical world and a lot of people look at health from the angle of disease. So we're talking a product here that we're studying with heart disease. We're studying it with Parkinson. But fundamentally, the product is not about disease at all.
Right.
What we have discovered is that your stem cells are your repair system. Just like the human body has an immune system, in the exact same way, you have a repair system. Nobody will think twice if you get a cold to go and take echinacea and astragalus to boost your immune system. Like it's the thing to do. Well, if something is broken in your body or not functioning properly or is in decline because it's losing cells, if you don't have enough beta cells in your pancreas, it's diabetes. If you don't have enough cardiomyocytes, it's heart disease. If you don't have enough cells have been damaged and killing your lung, it's emphysema, and so on. So cells making dopamine in your brain, it's Parkinson. So stem cells can become all these cells and repair all these tissues. It's simply the repair system. All the problems that we have in our 50s, 60s, 70s, 40s even, we didn't have them in our 20s. And one of the main differences is that we had way more stem cells in our 20s than we have in our 60s. So all we're doing is that we're putting more stem cells in circulation, and then the body has those stem cells to basically utilize as its natural innate ability to repair. That's really all that we're doing. We're not curing anything. We're just giving back to your body its ability to repair. Now, we're doing this with plants. There are other things that we can do in terms of lifestyle to help stem cells. Physical activity will put more stem cells in circulation. Intense physical activity will also push the blood into your microvasculature. So it's really good for the delivery of stem cells, the overall stem cell function. So that's one thing that is relevant. Fasting has been shown to put more stem cells in circulation. When you're fasting, those stem cells are more sluggish, more dormant. But the moment you resume feeding, then you have more stem cells and they really kick into gear. And what is interesting is that studies, it's kind of, I wouldn't call it preliminary, but they're not like a lot of those studies that have been done. So it demands to be duplicated, but at least the data is pointing in the direction that if you take a stem cell before fasting, and then you look at its ability to migrate through tissue, to move and to differentiate and to proliferate. And then you fast, and then you take a stem cell after fasting. These stem cells behave as if they had rejuvenated, as if they were younger stem cells. So fasting is a good way to rejuvenate your stem cells in your bone marrow and have sort of allow them to have like the power that they had when you were younger. So these are like the two main things that you can do to boost stem cell activation. Now, the things that you can do to eliminate a suppression on stem cell effect, the main one is stress. So this was shown in different animal models, but essentially the moment that you release stress hormones in your bloodstream, the stress hormones will suppress the ability of stem cells to migrate, proliferate in your body. So essentially you suppress your innate ability to repair. And it's, to me, the way that the reason why it's important is that in our modern city life, I mean, is there a day that we're not exposed to some level of stress or anxiety? Like it's a constant presence in our lives. So if we don't develop a way of really controlling and managing stress, like not sweating the small stuff, then that means we can live sometimes for decades with having a suppressed ability to repair. So there's no question that this is associated, that I think it is one of the main reasons why stress and anxiety for decades now has been associated with almost like any kind of age-related disease, because you suppress over decades your ability to repair. Smoking cigarettes, drinking alcohol regularly will also suppress stem cells' ability to work in the body. These are like the main ones that have been documenting as having an effect, positive or negative effect on stem cells.
Right. Yeah, absolutely. And then now, the WHO has come out and said alcohol is actually a carcinogen, right? And so that leads to, well, how does cancer develop? Well, there's mechanisms in these stem cell kinetics, right, that actually, we won't get into the discussion now, but I am curious, have you taken someone or had any anecdotal data, someone that, let's say, was exposed to something like Agent Orange or chemotherapy or something like this that will downregulate stem cell production or radiation exposure, right? Whether it be therapeutic or not, and actually seeing the ability to actually turn on, increase stem cell count, turn them back on, like, et cetera. Have you had any conversations like this?
We don't have any data, but it's a very, very, very common report when people are on chemotherapy, any kind of cancer treatment, which chemotherapy is like all these drugs are essentially aiming to kill cells that duplicate really fast, highly proliferative cells, because that's what cancer cells are. But stem cells are that too. So that means whenever you wipe out cancer cells, you also wipe out stem cells. But you need your stem cells to produce your immune system and to produce, like, that's why gut issues, losing hair, like so many of these side effects are directly linked to killing cells, that your stem cells in your body. So we have seen, and I don't have the mechanism of action here, but it's very, very common. Somebody will be in a treatment, will be taking StemRogen release, and will come back and will say, well, in my clinic, I'm the only one that has not lost their hair or had any of the sort of the side effects that is oftentimes reported. Some people have told me, I'm told that whenever I go for my shot for chemotherapy, that I'm told that I should take like 3 days off after to recover. And they say, I just go back to work right after. It's not affecting me. So I've heard a lot of those stories. I've never wanted to document any of them just because of the sort of the, I mean, this is a big FDA issue to cancer. We're not making any claim. It's nowhere. We don't talk about it. But for patients who are going through that experience, man, try it, see for yourself, don't promote it, but for quality of life, for humanitarian reason, let's at least just state the fact that people are reporting a lot of benefits with this.
Yeah. And there's no reason, not to. I mean, it's not going to cause harm. I mean, we're talking about plants, and anyway, that's great.
I mean, I did think for a little while, I was thinking, if you prevent the effect of chemotherapy, then of course you prevent the side effects of it. So and that's why doctors will say, don't take, free antioxidants, like a lot of things you don't want to take during the treatment because you want the full effect of the treatment. So my question was, are we in some ways mitigating the treatment? In which case we probably need to tell people not to take the product during the treatment. But everybody that come back and talking about how it's helping them on the side effects also come back and talk about how they're the patient's doing like the best, in the group, wherever they are. They have a great story of recovery. So we really see only benefits with that combination. So I'm not going to say that it's good for cancer treatment. Let's just say that people who take the product with cancer treatment tend to have great experience.
Sure. That's awesome. And just really good to hear that. And I agree, just for humanitarian reasons, like, we're just here to help people. I mean, my grandmother had a really bad case of lymphoma, and it had spread through the entire body before we were able to, identify it. And this was several years ago, was not familiar with your product line. I had lasers on her every day. There's really good things that can be done for people in these scenarios. And she was actually dancing around her living room, when they gave her 2 months to live or something, like a year down the road, she's fully functional and doing all these things. She did pass away from other things going on. But anyway, I think that we're definitely talking about, the leading edge, the most dynamic breakthroughs in medicine. I mean, we're talking about some really exciting stuff. If we were to fast forward, let's say 10 years, 20 years down the road, what is this? And this is kind of a esoteric question, so I don't know how you want to answer it, but where is this technology taking us in a few decades? What do you see on the horizon? Where is this going with stem cells and the technology we have? Like, what do you foresee here?
Well, I see a number of things. We briefly mentioned these Muse cells, which seems to be like fascinating cells to work with. So I think technologies will be developed to properly isolate them, grow them, and start to use them. They may become sort of the cell of choice to use in the future, because umbilical cord stem cells, they're great. Like, there's a lot of usage for them right now. But in the long term, I don't think that they're the ideal source of cells for a number of reasons. The first one is just supply. Supply is bound to be limited. Like, there's way more people that need stem cell treatment that we have babies born right now. So somewhere there's a limit to that supply, plus some other potential negative, but let's not get into that right now. So I think the path will go toward these kinds of cells. So that will be one approach. Another approach will be to take stem cells, either umbilical cord or your own stem cells, your own fat-derived stem cells, and then start to do genetic modification to these cells. This is already done. There are clinics that can do that. For example, there's a clinic, the BMI clinic in Costa Rica, where they've taken the clotho gene, which is a gene that has been very strongly associated with longevity. So they take your stem cells, they insert that clotho gene in that stem cells, then they multiply that stem cells, make it into a population, and then we re-inject that stem cells in you. These stem cells go back, repopulate your bone marrow, and now you've got a new strain of bone marrow stem cells in your bone marrow that now have that longevity genes. So gene modification is something that is happening also down the road, but it's hard for me to not think in a different way from what probably a lot of stem cell scientists think, because of the fact that I've sort of stumbled on this. I've developed this whole approach, which is called endogenous stem cell mobilization, which is instead of going in one place where on one day as a one-time injection, you get an injection of, let's say, 100 million stem cells. What if you start to release 10 million of your own stem cells, but you do this every day for a year? You have released 10 million a day. So that means it's 3 billion, 30 billion stem cells that you have released over that year.
That's huge.
It's huge. It's huge. So you do this, let's say, twice a day. Now it's 6 billion of your own stem cells that you have released. And you've released that in a way that is very physiological. You're not supposed to suddenly have a one-shot injection of 100 million stem cells. That is not a natural input of stem cells. When you have an injury, let's say a heart attack, a bone fracture, normally what is happening in your body is that within a matter of 10, 12 hours, compounds are detected in your blood that are known to trigger the release of stem cells from your bone marrow. Then after the second day, we can start to see the increase in the number of stem cells. Within 3 to 5 days, there could be up to 10-fold increase in the number of stem cells in circulation. It's this wave of stem cells. So there's a build out and it goes down. So there's a whole process that is set up. The tissue that is needing repair is releasing compounds to attract stem cells to that tissue. This phenomenon is not naturally present in the body when I just basically inject a number of stem cells. So what I'm thinking here is that if you allow your body every day to just release a lesser number of stem cells, but you do this physiologically over long periods of time, you basically end up with a much greater impact over time. It's physiological. You don't have to travel. It's your own stem cells. I mean, the number of positive, I'm not saying it's the answer for everybody, but it's definitely the answer for the masses. So to me, there are a lot of technological development that will take place in the world of stem cell research. But I hope that what really sinks in the population is understanding that you have a repair system. There are ways to boost that repair system. And if you do that every day, the results seen in our heart patients, in the Parkinson studies, the results can be quite far reaching.
Yeah. No, that just makes sense. I mean, usability is huge. And you're right. When you get those stem cell procedures done, it can be a super physiologic dose. How much of that's really being used? Mm-hmm. How much of those cells are actually just, going to die or be reabsorbed by the body? And some of those questions really just are not answered yet. So you're right. I mean, it just makes sense. And then not even to focus on the clinical part, but I mean, it's cheaper, right? I mean, you take your stem cell product line, over the course of a year compared to some of these stem cell procedures, and it is cheaper. So easier to use, cheaper long-term, it just makes sense to me. And I think you're right. Like this idea of endogenous stem cell production and mobilization, I agree with you. That is truly innovative and where medicine needs to be going, where health needs to be going. That's huge. So I know that, I'm extremely grateful for the work that you've done. My patients are extremely grateful for the work that you've done. My family's grateful for the work that you've done. We're, very humbled and honored to have you on the show today. Can you give my listeners some resources? Where can they go to find more about you, more about, what you're doing, et cetera?
If you go on our website, which is StemRogen.co, StemRogen.co, we have, you'll find a lot of articles really documenting stem cells, how the products are working, the science behind all of it. And I use the handle of Stem Cell Christian on both TikTok and Instagram. So if you have any question, post them. The team brings that to me, and I regularly make videos here to just answer all these questions. And if none of these are answered, you will have an email on our website. Just send an email, and we have a team that is going to respond to them. And if they can, they'll roll it up to me, and I'll answer it.
Fantastic. Before we sign off here, is there anything else that you'd like to tell the world?
There's one thing we didn't touch that I think it puts all of this into kind of a greater context. I find it fascinating that we're talking, because we don't have those kinds of discoveries very often in the whole world of medicine. Here is something that every single everyone born on this planet has experienced, that their body repairs. Everybody has had a cut, a bone fracture, something in their life, and they've witnessed that their body is recovering. They've had this many times in their lives. And yet in medicine, that part of their life is not talked about, is not explained. You break a bone, the doctor puts you in a cast and says, come back in 6 weeks. You come back 6 weeks later, we remove the cast, the bone is repaired. Nothing is said about the process, because until now, it was not known what was this process of repair. And now we're discovering what it is. It's the role of your stem cells in your body. So when we talk about it, it looks like we're coming from a scientific, technical standpoint, technical angle, with something that is new, people scratching their head, kind of thinking, is it true? And I'm just saying, step back here. Everybody has seen that their product is repairing. Everybody has seen that when you pass 30, you get into your 40s, you don't repair as fast. You don't recover as fast. It is just the proof to you in your own life that you do have stem cells, the decline over age, and in later part of your life, as you start developing problems, it's all caused because you don't have as many stem cells. That's what we're talking about, leveraging your body's innate ability to repair.
Right. That's absolutely beautiful. And I love the solution here. It's fantastic. Just for everyone listening, my patients, my audience, everyone, I love this product line. I wouldn't have this conversation if I don't. I think everyone knows how I feel and why I'm doing what I'm doing. I truly want to change global healthcare. I fully support you guys. Let's start using these products. Let's start improving your lifestyle factors, like what Christian was talking about earlier. There's so many things that can be done here to improve overall health and wellness. Of course, talk with your doctor, make sure it's a good fit for you guys, as always. But man, I've really enjoyed this conversation. This has been highly enlightening. In fact, as soon as I sign off here, I'm going to go take my second dose of Stemmergen for the day, which I will admit, sometimes I forget because I get busy. And so I don't always get my midday dose in. So I'm going to make sure and do that today. But man, I really appreciate your time. I appreciate your knowledge, all the things that you're doing in the world. Thank you so very much.
My pleasure.
If you're into exploring the latest in health and brain optimization, check out my other episodes of the Longevity Formula. We explore everything from cutting edge therapies for chronic conditions to practical ways to optimize your health and longevity through functional neurology, cutting edge therapies, and much more, kind of like what you've heard us talk about today with Stemmergen. So if you're listening to this and you're thinking like I'm thinking, man, I want to make sure that I'm personally taking these products. I want to make sure that my loved ones are personally taking these products. My patients are taking these products. This is just, there's no reason not to, in my opinion. We do have a link that you can, go and check out the products and order and really get started on these things. And that is StemRogen. So StemRegen.co. So .co/Crawford, CRAWFORD. So StemRegen.co/Crawford. If you got as much out of this conversation as I did, please take a second to hit that subscribe button, share this episode with someone who needs to hear it, and leave us a quick review. It really helps to get the message out there. Thanks for being here, and I will see you next time.
We hope today's episode has inspired you to take that next step toward your best self. Remember, the path to longevity is paved with small, daily decisions. Your journey is unique, and every step, every choice, brings you closer to your ultimate vision of a healthier, happier life. For more insights, tips, and resources, visit drbrandоncrawford.com.